to this week's edition of NHIS in a Week. In the headlines, NHIS celebrates Otumfuo's impactful reign as Asantehene. Deputy Chief Executive in charge of operations tours Central Region CPC, regional and district offices. Novartis pharmaceutical company meets NHIA management. Now the details. The chairman of the board of the National Health Insurance Authority, Dr. Ernest Kwaku, led an entourage of the NHIA staff comprising the Chief Executive, Dr. Da Costa Abuaje, Deputy Chief Executive in charge of Finance and Investment, Mr. Francis Owusu, and Deputy Chief Executive in charge of Operations, Mrs. Louisa Atta Ajeman, some directors, deputy directors and other staff to pay homage to the overlord of the Ashanti Kingdom, Otumfuo Osei-Tutu II, at the NHIA Palace. In a brief address by the board chair, he acknowledged the king's great impact since his installment some 25 years ago.
25 years of community or 25th anniversary, I said, now it's said,
Dr. Da Costa Abuaje pledged further collaboration between the NHIA and NHIA Palace.
The clinical pharmaceutical projects now say insurance the component so the division less than 80 mapasseya into me and Costa is the corporate social responsibility as Kaya Yono, Kakra, number one, and now the Jumano.
A high-profile delegation from the National Health Insurance Authority, led by Deputy CEO in charge of operations, Mrs. Louisa Atta Ajeman, inaugurated a new ultra-modern district office complex in Atrema Imponia in the Ashanti region. The district was previously recognized as the best performing in 2014 and 2015. The Deputy CEO commended staff for their hard work.
National Health Insurance Authority, Executive Management, encouraging more in staff, senior managers, officers. Munina drivers, cleaners, munina yeniso yemoye, onkoswa munye juma.
The Deputy CEO reiterated the government's commitment to the NHI's growth and sustainability, as well as eradicating illegal charges.
Yes, Ramo, Atrema Imponia Fonina. Some way na yem fighting Adia Bruni Freno co-payment by National Health Insurance Freno illegal charges. If you say a idea, a kutia scheme MPP abaya daroma edia ba Ghana nibia benefits ye be sure say na na obi won na be si former man na mo ba boy ni yetimi atu ano sele ye hunu adife fe ya na ename e mampani na ado down kwa ebufo ado so ado premai ado show boy achipie si awunu bremu.
Dr. Da Costa Abuaje has pledged his commitment to intensify efforts to combat illegal payments within the NHIS. A key aspect of his strategy involves a comprehensive review of the NHIS medicines tariff, with plans to secure parliamentary approval for automatic price adjustments to align with current inflation rates. This initiative aims to enhance transparency and fairness while ensuring equitable access to healthcare services for NHIS members. He made this known in an interview with City TV at the head office in Accra.
We pay an average of 108 million every month cities to providers. Now, I've been engaging providers. Providers are telling me that, yes, we are happy with the payments, but there's a challenge. The challenge is the tariffs are inadequate.
Very low.
Very low. They are telling me that, please, review the tariffs And when I started, I told you that there is a team, a strategic purchasing unit is now reviewing the tariffs with all the stakeholders. Now, I plan, by my experience, to stop co-payments. It is a bold statement. I'm telling you, I plan, by my experience, to stop co-payment. How would I do this? I will achieve this by, obviously, after the tariff review, okay? After the tariff review, the prices will go up. I will seek approval from Parliament to make sure that we do what we call the automatic price adjustments. We tie it to inflation. So in the UK, that's what we do. So there is a committee that will be set up. Immediately that the prices go up, the committee will set up. And bear in mind, we can cover this within our allocation formula, because always you can have 30% excess in terms of what you have planned. This year we don't have it, okay? So if I guarantee the automatic price adjustment like we do in the fuel field, okay? Now the problem will be that in Ghana here things do not go down. You see, because people will, that's what you see. So if providers are actually getting what they want, the prices that they get it, I believe that then it will be morally not right for them to be charging our clients under the 95% of what we cover.
Still in the news, a 4-member delegation from Novartis, a drug manufacturing company led by Resi Muchilwa, Sub-Saharan Africa head of Novartis, visited Ghana to meet the NHIA management. The meeting was chaired by the Deputy Chief Executive Officer in charge of Administration and Human Resources, Dr. Mrs. Yapuku Abedin, and had other directors of NHIA present. The discussion centered on present and possible future collaborations between the two institutions. Of particular interest to the team was the Market Access Program for hydroxyurea, which has been reimbursed by the NHIS for sickle cell disease patients since 2022. The Deputy Chief Executive in charge of operations of the NHIA, Mrs. Louisa Atta Ajuman, as part of a 2-day working visit to the Central Region, toured some selected NHIS district offices to interface with staff, learn firsthand some operational challenges, and prefer solutions to ensure smooth running of the scheme. The Deputy CEO, together with the NHIA delegation, visited the Central Regional Office and the Claims Processing Center in Cape Coast. The NHI's team conducted a successful registration exercise at the Samatex Sports Stadium in Samraboy during the Samatex FC versus the Accra Great Olympics match. The team efficiently registered 125 new members, renewed 125 existing memberships, and completed 4 new registrations and 4 linkages of Ghana cards and NHIS cards. The team also educated supporters on the benefits of joining the scheme and the need to download the My NHIS app. The outreach efforts showcased the team's dedication and effectiveness in expanding NHIS membership.
Hey, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for internet. But no shaking. I have NHIS already.
After you're on a line, ting.
Ina, look at you. What are you going to do in the office when you can just download their app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on My NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Miss Steph, I'm starting work next month.
This is how we wrap up on this week's edition of NHIS in a Week. For more stories, do log on to our website www.nhis.org.gh and visit our social media handles displayed on the screen below. Thanks for watching.